All right. Good afternoon, everyone. Thank you for joining in today's webinar on the Coronavirus Challenge Box. We currently have 5 challenges running on our website. All of the webinars, the daily webinars that we are running are recorded, so you can always access them later through the links that we publish on Discord. We've created a dedicated YouTube playlist that collects all of these webinars. So if you've missed any content while it was broadcast live, you can always go back and see it later. The hackathon is getting into its quite advanced stages. We are expecting teams to submit their projects by Sunday. We will have brief judging and announcement before Passover begins. So time is short. That means if you have any questions or if you're stuck making progress or if you need any type of mentoring, make sure that you talk to us via email or via Discord or by going on these daily webinars so we can provide you the support that you need in order to complete your project. If you need more time for your specific projects, please also let us know. The goal here is not to meet some deadline, but to provide timely support and help to the people who need it. And that's why we don't want to be like wasting too much time in this hackathon. So we gave strict deadlines. So we currently have the 5 challenges running. We have 2 challenges that have to do with preventing infection with the coronavirus. That's the Corona Guard and the Corona Catcher. We have the Older People Challenge, which is about making services for older people in home quarantine accessible. We have the challenge that we presented to you yesterday, which is the Corona Safe Village, which is a planning challenge on how to create housing areas for people working in agriculture or construction and make them safe from the coronavirus, from the spread of the virus. And today, we're going to be diving into the Race Against Corona challenge. We have Dorin Turgeman from Nala Foundation. Am I saying it right, Dorin? And she will be...
Yeah, it's the right name, and then Nala, just Nala.
Okay, cool. So Dorin, I will give you the microphone in a minute, and Dorin will tell you all about the challenge. As I said, this is going to be available as a recording later, and you will be able to ask her questions about the race challenge. In any case, after Dorin finishes, if you have any more questions about the hackathon in general, or if you need any type of support, you may ask us. If you have any question at any point, type it in the chat and we'll address your questions when appropriate. So, Dorin, the stage is yours.
Thank you very much. So my name is Dorin, and I'm head of operation at Nala. Nala is an NGO that works on public health, mainly in Ethiopia, but the model that we're working with is eligible to many disadvantaged communities around the world. We deal mainly with public health, which is very relevant these days, and to the coronavirus that is spreading, since we deal a lot with sanitation and access to water, to hand washing stations, and so on, as well as hygiene practices, awareness to health education, and so on. As I said, we work in Ethiopia mainly for the past 12 years, since 2008. We started the work in schools, providing health education to students, and then moved forward to working with communities and through the health systems in Ethiopia. The main challenge right now that Ethiopia is facing with the spread of this virus is first lack of access to sanitary conditions, to sanitation facilities like hand washing station, proper latrines, and so on. And the other challenge is the fact that the Ethiopian health system doesn't have the capacity to deal with such a spread of the virus in their country. They lack uh, the diagnostic tools and the treatment tools. So right now, as we're facing 21 cases in Ethiopia, although we are not sure what is the actual number of cases, since, as I said, diagnostics is very difficult right now. We don't really know the actual number of the infected population of the disease. And so we are trying to prevent its spread right now, working with the Ministry of Health in Ethiopia, local CBOs, that's community-based organizations in Ethiopia, mobilizing the community to have awareness raising for the importance of social distancing and hand washing, providing wash facilities for hand washing stations as hand washing stations and so on, and encouraging the community to take steps themselves in order to improve the conditions and to prevent the spread of the disease. We are also, one challenge that we are facing is that once this reaches rural communities, we'll have a big problem with awareness, since internet and knowledge doesn't really get to these areas. And so they have lack in knowledge about what is going on basically right now, and the importance of practicing hand washing and social distancing. Now, hand washing and access to water is something that we've basically dealt for the past 12 years anyway, so this is very intuitive for us. We're using all our resources right now that we have in Ethiopia, mobilizing them towards the prevention of this disease, as well as using our local staff to promote this in the in the Ministry of Health, within the communities and the connections that we already have. The challenge faces the issue of the knowledge and how to provide proper knowledge and spread of awareness for the prevention of the disease. I assume everyone who is interested in the challenge read about it and what we are looking for. It's very simple, simple solution for this issue. And yes, I think that's about it in general. I was told that there will be probably some questions, so I'll be happy to answer anything. And if there is any information that is lacking right now, please let me know.
All right, Dorin, thank you very much. If anyone has any questions for Dorin, this is the time to write them down in the chat window. While you do that, I'd like to review the challenge page on the website. As I said, you may use the chat window to write your question at any time. So the Race Against Corona Challenge. These are the wrong dates. The actual date, as I said, for submission is next week on Sunday. So what we have here, there's also a Hebrew version of all this in case you're an Hebrew speaker, but we have the challenge statement, which tells you in clear words what it is that Nala is looking for. Then what you should submit. So what we're looking for is creating a model or building on existing options, like is described here in the text. Here it says who can participate, but in any case, if you're not in the list, but you have something to contribute, you can also participate. As it says, everyone is welcome. And this is the criteria for a successful solution. Measuring the quality of the solutions will be done based on these criteria, which are technological applicability, minimal cost, innovation, and suitability to the targeted communities. I'm guessing many of you are not working day to day with these types of communities. So we have these 3 mentors available for you. Excuse me. If you need to ask them any question, or if you want to set a one-on-one meeting, you can do it via the challenge channel on Discord. All right. So, okay. So Omer is asking if there is any arrangement to help people who are hard of hearing to make this accessible for them. So I guess I'll also type the answer, but all the information about the challenge is available online, and we're checking to see if there is any ability to add captions to this video. I'm guessing after it goes on YouTube, there will be automatic captions added. I'm just going to write it down in text. If you have any additional questions, please, now is the time to ask. Okay, I guess, oh, there we go. Anya Schatz is asking, Dorin, how do mailing systems work in Ethiopia? איך עובדות מערכות הדיוור באתיופיה?
Okay, so the mailing system in Ethiopia varies. Ethiopia is a very large country. It's about 20 times the size of Israel. It has different communities. Some are urban, some are rural. Mailing is usually just through the urban to the urban areas and not to the rural areas. It's very hard to mail things. So any sorts of mail is for rural areas is not very applicable, I would say. For urban areas, they have their national mailing system, usually works pretty well, even though the large distances and although all of the conditions, they do work pretty well. The best, I would say, the best method of information, messaging and information transfer is through radio for rural areas, since radio is one of the only options for any entertainment in these areas, since there are no TVs or they lack internet, no smartphones, things like that. In the urban areas, in the main cities, they do use Facebook, Twitter, and other social media platforms, Telegram, and so on. So this is also a good way for urban areas. I can say that right now we are focusing on urban areas because we estimate that if it will spread, it will first spread in urban areas, since most of the cases right now are in Addis and some of them are outside of Addis, but also in areas that they have airports and such, so they're very urban. Then phase 2 will actually be reaching the rural areas, since once it does spread, there is no knowing where will it go and how it will it reach. I can tell you that since up till now, I think the Ministry of Health conducted less than 1,000 samples or testing. So we don't really know the actual number, as I said before, but right now it seems to be just in the urban areas.
Thanks. Matan Hellman is asking if you have an example for similar things that have been done before.
So I think that we have never dealt with a spread of pandemic in Ethiopia. Even the Ebola virus that attacked Africa didn't reach Ethiopia. So we don't have a lot of experience with this. The work that we do relates to neglected tropical diseases that are diseases of poverty and are diseases that due to lack in sanitation facilities and lack of awareness of the importance of personal hygiene. Um, though they are called neglected tropical diseases because they don't get the focus that other diseases like malaria and HIV/AIDS are getting. So the work that we do is on the level of behavior change as well as sanitation facilities and bringing up the quality of life. But it's a long-term project. Most of our projects are long-term, minimum of 3 years, sometimes even 5 years. So we haven't really dealt with something like this in the past. And all the examples that I can provide are related to very long-term projects. I mean, we did have social media campaigns and radio campaigns, community events for awareness raising, which are not very appropriate at the moment. Um, uh, and a lot of the work we do is based on education for school-age children and education for health professionals. But those methods are now not available, most of them. The health professionals that we usually work with are community volunteers, and right now, most of the uh, formal or official health professionals are dealing with treatment and diagnostics, and the assistance that they need has to do more with the conditions of their work and less in awareness but we do try to provide sanitation conditions that are appropriate for health centers, at least in hospitals.
Thank you. Komar Elazar is asking, I hope I'm pronouncing your name right. So my idea is about disseminating information through NGOs and offering a platform for knowledge organization and information gaps. Could this be relevant?
Well, I would add is exactly the mechanics of that because we work with local NGOs. We are basically a registered local NGO in Ethiopia as well, trying to work on disseminating the information. And this is something that we're already doing. The issue is that reaching all the communities in all of Ethiopia is very difficult. And a lot of the areas don't have NGOs working in that work there. For example, one of the sites of our projects is one that we are the only ones working there. Um, and there are a lot of sites where you won't see any NGO. So I'm asking what exactly is the method, because having the information gathered and um, and collected, that's one thing, but the dissemination, I think, um, is the big question, how to.
Yeah. Anya Schatz is asking, is it common to have community centers in rural areas or schools that are like community focused?
Yes, there are a lot of community areas basically in all of Ethiopia. It's very common. A lot of them also have adult education programs, and people can come there to be taught about agriculture, health. This is one of the programs we are working with. But because of the pandemic right now, everything is closed down, and there are restrictions on gatherings of people for no more than 10 people, same as very similar to here. So basically it's not a mechanism that will operate at the moment. Schools are closed, and one thing that does work for gatherings are the religious centers, but these are also the point for contaminations, so I would be careful with that. We are actually working with religious leaders to try to have a different first of all, awareness to keeping at least 2 meters distance from one another, even during sermons and worship. But we are trying to have other solutions, for example, radio sermons and things like that, in order to avoid those gatherings. So that's less of a method that we would use right now.
Thank you. Okay, we'll give you a minute to ask additional questions. In the meantime, you can watch this beautiful video of old times, happier times.
When people could gather.
Yeah, exactly. When people could spread diseases all they wanted.
Yep.
Basic human rights, you know, just let me spread my diseases. Okay. Seems like there is no additional questions. So I have a couple more things to talk about. So you still have an opportunity to write. Doreen, don't leave us.
I'm still here.
And so thank you very much, Dorin. And you can always contact any of our mentors or challenge owners via the Discord platform, or you can just ask us and we can help you with connecting with them. So people have been asking about timelines and what they have to actually submit at the end of the hackathon. So just a quick review. The deadline for submission for all challenges is Sunday, coming Sunday. I think it's the 6th of March. Is it? Of April? No, it's the 5th. That would be the deadline to submit your projects. Submission of projects is done via the Shawi platform. We will make sure to send an additional email because some people haven't been able to find the link. It appears at the end of registration and you also have it on Discord. But we will send an email, an additional email with the link to the platform. You just register there as a team. You don't have to do it with all team members. It's enough if you just have one team member register on behalf of everyone. And there you can submit your project. You can submit files or text or links. But the best thing you can submit is a very clear document or presentation that says what is exactly the problem that you're tackling, what is the solution that you're proposing, how it's supposed to work, why it's better than other solutions, and also some proof that your solution is feasible and that it meets the judging criteria that we have posed for each individual challenge. So that's the way it's going to work. Submission is by Sunday. After Sunday, the judges will be able to review the things that you have submitted, and we will announce the people who won or qualified. I'll give you another minute to post questions in the chat. All right, it wasn't a full minute, but I think it was enough if you really wanted to write something. So guys, our main communication platform is Discord. So you may always go on Discord and talk to people and form your teams. If you have any questions, you can do it on Discord. And remember that we have a webinar like this happening every day at 5 or 6 p.m. Israel time. So you can always connect. It's always with the same link, and we're letting you know about the different times every day. Thank you all. You're doing something great for humanity. And, you know, it's very, I feel proud to be part of something like this. See you tomorrow and have a good evening. Thank you, Dorin.
Thank you. Bye.
Bye.